My key takeaway from CROI this year is that PrEP works, and now we need to figure out how to get it into the people who need it most, and that we have the tools that we need to end the HIV epidemic, and we just need to figure out how to deliver them better.
My biggest takeaway from CROI 2018 is as we get closer to ending the epidemic, both in the United States and globally, I think there's kind of a palpable excitement in the HIV research community. There's, I think, a continued need for activism to kind of achieve that last mile in this effort. And it's really great to see these incredible minds and folks filled with passion and dedication to the field come together and genuinely try to figure out how we can best deliver the tools we have that we know work to the populations who are most in need of them.
Well, other than Depivering Ring, which is very exciting, I work a lot on PrEP for prevention as well, and my biggest takeaway is how normalized the discussion is now on PrEP. Still tremendous need and frustrating disparity, but when there's access, then people don't get HIV and there's community level impact. So my biggest takeaway is PrEP should be about access. Stop fussing and give people the opportunity to decide whether they're going to use PrEP or not. But when there's access, people use it and people don't get HIV.
My biggest takeaway from CROI so far is that they've actually brought to light the importance of mental health among individuals living with HIV, and that if we do not target mental health, I think it really goes hand in hand with HIV, whether it has kind of started before they contracted the virus or even after. Being able to kind of work on mental health, I think, is just, it's necessary in order to improve the lives of these individuals.
I think that my biggest take home from CROI so far, as someone who's interested in HIV prevention, particularly focusing on implementing PrEP, is that there are tremendous disparities in terms of how PrEP is being used to impact the HIV epidemic in this country, including racial and ethnic disparities by gender, sexual orientation. So I think we really need to refocus our efforts on addressing not only overall use of PrEP in the population, but really trying to get PrEP into the hands of patients and clinicians in communities where the need is the greatest, because that's the way we'll have the biggest impact, and also to address inequities, which are really something that I believe are important to address so we can have a fair and balanced community in terms of serving everyone in this country.
I suppose a couple of my biggest takeaways so far is that switching patients that were on a dolutegravir-based regimen were switched to a bictegravir-based regimen, and it was a large study and it showed it was non-inferior. So I think that's what you would have expected. They're both very potent integrase inhibitors, and so switching from one to the other presumably would go just fine, and it did. So that's day one.
A lot of the studies that we do, I think, focus on how young women are an adherent to PrEP, but that potentially it's not necessarily all about adherence, that there's a biological mechanism at play, and that there's with imbalances within the vaginal microbiome, this might be influencing kind of PrEP trials, and kind of looking at that is really important, and moving away from kind of just blaming women for not being adherent was one big takeaway that I got from this morning's plenary. And then right after that, we heard about how mental health plays a huge role in not only the treatment uptake and linkage to care, but in prevention efforts, and that kind of across the board and globally, we aren't doing enough to kind of address mental health concerns for people both at risk and living with HIV.
The biggest takeaway here, I think, it was really, I think when Carlos Del Rio, his session, where there should be an urgency and activism that we need to strike up to the disparities in one, new diagnoses for HIV that's occurring at a high rate in the South versus other areas of the country. We really need to regenerate and probably strike a call to action, I think, in order to divert money, resources, and attention to areas where patients still are at high risk for acquiring HIV where we have a lack of perhaps preventative measures, a lack of PrEP uptake, a lack of understanding for prevention. So I really think that we need to rebalance our attention to these hotspot areas. Again, given that we have had some progress, the new diagnosis rates are a little bit lower since 2010, perhaps by about 11%. From the latest CDC data, we still have about 40,000 new infections per year, which we should regard as a call to action as we had at the start of the epidemic.